So dear doctors, we're going to start our orientation class on Plab. As you can see my screen, which is a blue color, beautiful screen. So I'm going to tell you a few things right now about the Plab, which will be useful for all of you. In the meanwhile, you can also ask me a few questions. All right. So now, as you can see about the Plab, you need to know about certain, what are the steps and all this thing. Now, the first thing that comes is an English test, and that can be IELTS or the OAT. So IELTS, it has to be each band 7. It has to be, I repeat, it has to be each band 7. For OAT, it has to be B in every grade. All right. So when you pass the IELTS and the OAT, you have to set up the GMC account. As you can see here, you have to set up the GMC account. All right. So after that, you're eligible for, scheduling your date for PLAB 1. Just to add here, PLAB exam is held 4 times in a year. So it means like March, then there's June, then September and November. So 4 times in UK. In the other countries, it's 2 times, it's March and the November. Due to increased demand nowadays, the more centers have been opened. Like example, in Dhaka, there is June that has been opened. In India, they also have opened June as a center actually. So they are planning to establish the all this thing, 4 times in a year, even outside the UK. Now, after plan one, you will get your results after 28 days. So when you get your result after 28 days, immediately after that, if you have a credit card, you can immediately take the date for PLAB 2. The immediate next date available, you can always take the date. PLAB 2 exam is held in almost every month. So the nearby available date that is available, so you can take the date. Now, after passing the PLAB 2, there's certain things you can do, like some certificate you must be required, like, um, in order to get the GMC registration and apply for the visa. So all you have to do, like the PLAB results, then police clearance, then some clinical attachment, then your referee, all this thing will be required to get the job actually. All right. And one more thing, like, you have to apply the job. There is a website called, nhsjobs.com. So where you can search for the job. When you get the job offer, they will, send you, the necessary paper. And with that one, you can submit it into nearby immigration department and, you'll get to go to UK to do your dream job. All right. So this is the like in short all the thing. Now you need to see like where all the things are held. So this is the GMC building, as you can see. So in this GMC building, all right, it's in the Manchester, so you can go and take the exam. So this is for the PLAB 2. As I mentioned, the PLAB 1 can be taken from any places. All right. Now let's discuss the first barrier, and the first barrier is always been the IELTS. So IELTS and the OAT nowadays both are fine. As I mentioned, you have to get 7 in each band. Okay. So, and in total, it has to be 7.5. The average has to be 7.5 with minimum 7 in each band. Okay. What we take is IELTS academic. Apart from that, we can go for the OET. Now, the UKVI issue, previously, UKVI, you have to take separately. It's a version of IELTS. Nowadays, it's not required. Now, you just take IELTS or OET one time, and you never need any other English test. All right. Like previously for job application, you previously had to go through UKVI. Now it is of no use. All right. Now for the OAT, nowadays OAT is changed into OAT 2.0 from the beginning of this year, and some of the parts has been a little bit changed in OAT, so don't take it so lightly. So you also need to put some effort for the OAT, but it is very much possible to pass the OAT exam. You can study of your own, and there are a lot of Facebook forum. You can download the materials for the OAT. You can also ask us, and you can also check in our group. The OAT materials are also given. All right, so you can download them and you can study by yourself. Some people, sometimes just required to, take care a little bit more in the writing section. So, you should take care of the writing a little bit more. All right. So we also have a group. Its name is O80 2.0 SMA. You can just go through this one and download all the OAT material, which is free. So difficulty level a little bit, I think, raised in OAT compared to the initial. So back in 2000, 18, it was so easy. Nowadays, a little bit changes out there. All right. Now, OAT preparation, you can take the preparation. Just to add one thing, the validity for OAT is 2 years. Okay, if you are in Dhaka, you can take the, you know, exam from Future Aid Dhaka. So they are the center for OAT. Now, previously, you need these differences and all these things. Nowadays, you don't need this difference because you only have to choose either IELTS or OAT or the UKVI, either of the one. If you choose, so it's fine. Like you don't need separate English test for the job. All right. So that's the thing. So this slide, I think it's better. We don't need it because English test you need just one time. So this is the latest update. Okay, now setting up GMC account. Okay, so the initial registration. So this is the relevant website. I repeat, this is the relevant website. You have to go there and register. It is like example, say if you want to make a Facebook profile or any profile, the same thing. You have to go there and set up some information, give some information, and you just log out and your information will be saved. All right. You also need the IELTS marks and all this thing if you want to schedule your PLAB exam. All right. Now, PLAB Part 1 exam, you need to know the abbreviation. Some doctors don't know the abbreviations of Professional and Linguistic Assessment Board exam. This is the PLAB exam. So PLAB exam is based on single based. I repeat, it is related to single based. All right. So there's a lot of venue you can see. So 2 times in Bangladesh, 4 times in UK usually. There is a recent update. In June there is a center opened in Dhaka as well. So there's, I would say, 3 times in Bangladesh. This year. All right. So there's so many other center you can see. You can take the exam from any center if you don't get seat in your own country. But personally, I feel you don't need to put or you don't need to invest too much, like just for part one, and try to take the exam from your own country. Now, these are the thing, this slide will help you to take preparation. I repeat one thing that, in this type of cases, as you can see, the preparation depends on three things: theory, your question solving, and, practicing mock test. So for theory, as you can see, the theory is based on book preparation like Oxford Medicine. There's a surgery book written by Dr. Sherry and myself. So this is also a popular book. Also, Oxford has nice surgery book. This book I have written because surgery books I found is not very concise and or well written like the medicine one. All right, so I have come up with a book. Apart from that, Kaplan Psychiatry is very good. Samson Note, 100 Case of Medical Ethics. So these are the books. So psychiatry, I want especially Asian doctors to give some more emphasis because of the background knowledge in psychiatry is not that up to the mark. Nowadays, more pharma questions are coming, so you need to also take care of pharma a little bit more. All right. So after finishing theory, you have certain things which is called question bank. Okay, so question solving. So question solving is based, the main base thing is the 1700. First time it was explained by Dr. Khalid Saifullah. He's a Bangladeshi doctor. So after that, like so many people, they came up with a lot of ideas like SUSH utility. In our classes, we also use the SUSH utility because it is arranged system wise. So I'll be giving also explanation of the 1700, and usually we follow the SUSH one. And there is another new one that is the Plabable. Is quite a popular nowadays. I think quite a reasonable. So I would suggest to buy it online because it's only 25 or $30. So it's very cheap, the Plabable one. And about the mock test, there's certain type of mock test. Plabable will have their own mock test. Samsung, Swami also shares medically. We have also our own mock test. All right. So you can take it online. You can also take the mock test in our academy center. All right. So these are the information for PLAB on preparation. I repeat, it is based on theory. It is based on question solving. It is based on mock. And I would also like to add one thing here. It is also based on your recall solving. So you can, if you want to add something here, you can add this one, that recall. Okay, so you can understand. So recall will also help you practicing the recall and all this thing. Now, how do you know Plab exam? You know how this exam is conducted. It is computer based. It is like written. You'll be given a to be pencil and the sheet, and you have to answer all this thing. 180 is the number of question you have to answer. All right. So this is the thing. This is how it looks like. This is how the exam paper looks like. So all you have to do is read the question from the question paper and fill up this thing. All right. So this is a sample thing is given. How to solve all this thing. All right. So this is important. Right. So this is the how the exam paper actually looks like. Next one. So useful website is a like another one with Road to UK is a very good one. Apart from, of course, you need to go through the website and learn like GMC website. Apart from the Road to UK is a very good website. You can check that. Um, Plab 2 exam is basically an OSCE system exam, and it is based on 18 station. Each of this station is 8 minutes of. Two of them are rest station. I repeat, two of them are rest stations, and you will get 2 minutes outside and 8 minute inside. Actually, there'll be a special sound. After that sound, you have to enter, and uh, before you take the entry, you have to do the hand wash by taking some sanitizer outside the door, and then you get inside, and examiner will check your ID, and like, they will ask you, do you understand your case, and they'll tell, okay, this is your patient. So that's how the exam thing is run. So total duration is almost like a 3 hour exam. All right. So in the particular day you have to be present. It is only held in UK Manchester. All right. So in PLAB 2 exam, basically they will be checking your clinical skill, your technical skill, ability to answer under pressure, and interpersonal skill. So uh, your fluency of English is also very, very important. Please mark this one. Okay, so do you want to see how a role player? So we'll give you link in future, like how to do a role play. So we'll be showing that one in future, and also it's given in our YouTube. You can just search with my name, Shahriar Ahmed Sujoy. That's the name. Shahriar, Shahriar Ahmed Ahmed, and Sujoy. You can go and check some of the role play videos are given there actually. So Plab 2, so Plab 2 coaching centers, a lot of centers are present in UK. You can go by taking some kind of visa. All right. And for Plab 2, we also have a center here in Bangladesh. We also have set up things, not only Plab 1, the Plab 2, and all these things. Okay. So registration with General Medical Council related to submitting document, ID documentation check, and necessary explanation paper from your university. So these are the things required for with general mainstream medical council registration. All right, few of the things which is relevant to clinical attachment. All right, there are few options you can sometimes do some observership. Very recently, I know someone from my medical, before after finishing the PLAB exam, she has come through some of the training there actually. Okay, so some are training post, paid post. So you can do that actually just after finishing the PLAB 2, you can utilize some of the time. So even before the result came, you can do. So even if you know few people, you can do that. So it will be useful for you because if there is any attachment which is related to UK, they'll give you more emphasis on it while getting the job. One more thing before I left this page, it is very much possible to get the job by applying online. So your interview would be taken by simple Skype. I repeat, the interviews are taken by simple Skype, some cases Zoom, and you just have to use a white background while giving the interview. That's all actually. So GMC is registration. GMC registration required some of these things for GMC: your passport, your MBBS equivalent, this thing, English test things, and job completion, and in evidence of fitness to practice, also good standing certificate. So these are for the GMC registration. I repeat, this is for GMC registration. Okay. So job apply and interview, I repeat, there are training posts, non-training posts. Basically, you will search for the job, and the job website is nhsjobs.com. That's the main thing, right? So paper for Plab in various stages, as you can see this one, paper for Plab in various stages. Papers you may obtain before internship finishes your MBBS and the transcript. Papers obtained after your internship completed certificate from your hospital, and in our country we call it BMDC. In Pakistan it's called PMDC. In India there's like MCI and all this thing. So that registration certificate you can bring it out. Why this is important? Because you know uh, if you completed your internship, you can directly join the FY2. Otherwise, if you don't have internship, you have to join FY1. All right. There's also possibility you can also join CT1 if you have sufficient training. CT1 stands for core training. Okay, so after core training you can go for the specialist training, and in future after finishing Plab you can also switch to MRCP, MRCS, and pursue your dream to be an consultant. Okay, you can also take the GP route, and after doing some specialist training you can be an GP as well. All right, papers you need to obtain after you plus PAP2. So now this is important and new for you. Certificate of good standing from in your own. For us, it's BMDC. Bangladesh Medical Dental Council. For Pakistan, is PMDC. So according to country register, letter from BMDC mentioning internship completed and the police clearance things. Right. So these all things paper would be required after the PLAB2. So job application as a doctor, what to do after PLAB2 exam. So you have to set up your NHS job profile. I repeat, you have to, set up your NHS job profile. All right. So this is important. So, and very, very important, a job thing depends on how many numbers of interviews you apply. If you get lucky, you'll get the job in first interview. Others, you have to be patient. You just need to keep applying. Those are told by the experts, or those are doing the job. As I said, you just have to be patient and just keep applying for the interviews actually, because even you will understand after your first interview that certain mistakes you might make in the interviews actually, right? So this is a certain thing for job and all this thing. Your medical degree is here. Your internship is FY1. Then this is the FY2. This is the place most of the doctor got job. We have some of the trainer like Dr. Remik or Dr. Amia. They got the job here directly. It's called core training. They got directly job here actually. So you can earn more money. So FY2 you can skip in that way. Okay, in future you can be a consultant. So this is the part for the consultant after doing this specialist training and all this thing. Other routes to work as doctor in UK is MRCP, MRCPS, MRCOG. You can directly pass them and also work as a doctor in UK. But just to add here, PLAB is the most easiest route because you are entering at the entry level, so more jobs available. MRCP, MRCS, MRCOG compared to PLAB, less job available, so it's a more competition. All right. So current job opportunities, a lot of field you can see, and every field has a certain job. And one suggestion for all of you that you should keep working. This is the suggestion from those that are doing job. You should keep doing some job in the field where you want to work actually. Like example, if you want to work in medicine, you try to do some job in the medicine after finishing the PLAB. It will be easy because your interview question started in this way. Uh, Introduce yourself. And next thing, why you want to work here. Thirdly, they will ask you, uh, what do you do for living? Are you doing any job? Okay, why should we recruit you? Do you have emergency exposure? So those kind of question you should be get through. So emergency medicine, ICU, these are even more better if you can do that job. But if you're passionate about surgery, you can also go to surgery. Two for trainer, they're also from the surgical field. They're working in UK and they're doing also surgery. So it's very much possible. So some people, there's a myth. People say, it's not possible to get job in the surgical field in UK. This is not right actually. Yeah, sometimes we also got not funny question like Dr. And to be a neurosurgeon. Yes, you can, but do consider that in your own country it's also tough to be a neurosurgeon, right? So I think you should understand the reality. Like neurosurgeon, even it is also demanding in UK, also demanding in India, Pakistan, Bangladesh, any Malaysia, any country. So it depends on the competition. You, if you're capable enough, you can get a job. Is it too late? When do I need to start preparing? Better late than never. So this is important. Okay, you can start anytime. You can start from any year, fourth year, fifth year. You can start preparing. Okay. If you think like what is my salary, like then um, how much a doctor earn in UK, in if I say in pound, 2,500 pound per month. There'll be yearly increment in future. Also, there is chance of locum. Locum is it means you can do extra job or duties by the locum. All right. And apart from that, if you become register, your salary would be increased, as you can see. If you become a consultant, in that case, it would be even more higher per month. All right. So why UK? There's certain sorts of things are here, so which you can just keep eye on. Is it too expensive? All right. Now, uh, this is one of the exam which is very much affordable. As you can see, Plab 1, Plab 2, so 230 pound, Plab 2, 840 the pound. GMC registration again, it varies. You can check from the website for the recent one, and some of the mock tests and coaching for Plab 1 2 is like 500 to 700. Nowadays we are also offering even more cheaper one, so it's anything is fine. So it's a cheap exam, coachings are also cheaper, so this is the reason you can choose Plab. And life in UK is also good. Okay, so this is a differentiating points for Plab versus AMC versus USMLE. Okay, so I'll be holding here for a few seconds and want you to see that, especially for the Plab, the main highlighting thing is very cheaper. I repeat, in Plab, things are very cheaper, right? So cheaper. Yeah, salary not really poor actually. In for Asian doctor is fine, 2,500 pound and yearly increment would be there, but maybe a much higher in AMC and in Australia and USA. That's the only thing. Job facility is a little bit more nowadays. All right, with AMC, I think nowadays little less maybe in USA, but any job you can get in any country if you are capable enough. Just remember this thing. No such matching issues which is relevant to US family. Visa rejection chances are less, which is more in USA. Part of exam 2 to 4, popular, yes, of course, most popular nowadays. Entry to training, not really direct like USMLE. Okay, validity after part 1, there is a time limitation. Okay, there's a good part with a good thing with AMC, especially if you pass the AMC 1, there is no time limit. But for Plab, this is one thing. Once you pass the Plab 1, you have to finish the Plab 2 in 4 attempts in 2 years. That's the thing. So experience doesn't matter that much, but still, if you suggested to have 6 months of training. In case of AMC, it's 2 year training is suggested. CUSMLE doesn't matter. All you need is a high score. Yeah. So the next point is high score. These are the some of the forum for all free materials, all free materials, all free materials. Okay, so this is our YouTube channel. You can go and subscribe to our YouTube. All right, and there's a nice video how to prepare plan one. You can go and see. These are all free videos. Okay. Okay, so these are some of our doctors. We are all are working together. Our things are run by UK doctors, supervised by them. A lot of things, all of the things supervised by myself, and so things would be easy. And Dr. Amia is working as a clinical doctor working for NHS in trauma and ortho. Dr. Amika is working for in the surgical specialty in Nottingham. So these are some of the good news. Why we need to hurry up? Because thing can be changed to UKMLA in 2022. We heard that's the myth again. We don't know when it will be actually changed. But if it will be changed, there's been a lot of new system, new things. So things will be more tougher. All right. So these are the things which you can check Facebook group, my Instagram, YouTube, and my own Facebook. So if there is any other question, you can ask. Thank you. So this is me, Dr. Sharrier. I hope so you enjoyed all these things so far. So good. So thank you so much.